Okay, how has the medical industry changed over the years?
It's become much more regulated. So when I was in college, I was able to shadow a surgeon and actually, as a college student, scrub into a case, scrub into a surgery, and participate in that surgery. But now it's much more regulated by governmental industries and agencies and HIPAA regulations that now we can no longer allow people who are not trained in the medical field experience what medicine's like that.
Okay. How many years of college did you take to get where you are now?
So I did 4 years of undergraduate, I did 4 years of medical school, and then I did a 3 year surgical residency.
Okay, what types of training do companies offer those who enter this field?
So there's not a lot of training from a lot of companies. When you graduate from residency, you'll join usually another practitioner's practice. It can either be hospital based practice or it can be a private based practice. And the senior doctors there sort of train you as far as the billing and coding and things like that. All your surgical practice and clinical practice comes from residency.
Okay. How has the economy affected the industry?
Right now, we're not really seeing an effect from the economy, but I will tell you a few years ago when we had the, not the depression, but when we had the dip in the economy, we definitely saw a lot of patients not doing the typical elective surgical procedures that we had seen before due to money issues.
Okay. Is this industry heavily regulated?
Yes. Yeah, there's a lot of there's a lot of different governmental agencies that we have to do checks and balances with.
Okay. And what are the usual reasons that people leave this field?
I have to be honest with you, I've never really seen anyone leave the field, but I would have to guess that due to the newer regulations that are coming down and those newer checks and balances that we didn't have before would be a reason why. Also, Medicare tends to cut our rates every year. So in the last 10 years I've been practicing, Medicare has cut my reimbursement rate every single year. And that's probably why a lot of older practitioners are getting out of it because of that.
Okay. All right. Thank you very much.